Hey guys, John Calhoun. Welcome to CT Surgery. Our goal here is to help you learn about our discipline, learn from our team and our patients about the unique aspects of what we do. Let me stress a few highlights for you as initial surgical residents on our service. First, learning occurs at the bedside. Troubles begin when your communication's poor. In surgery, we can't assume anything, so we have to make sure our assessments are thorough, are detailed, and orders, checkouts are clear and timely. An area where we really stress is an excellent and timely initial primary evaluation of the patient. Whether it's a consult or admission, our goal is to find out what the patient has. That depends on you. Find out what operations they had. Find out what their anatomies and symptoms are. Your notes should speak to what we're planning and why. We also believe patients are treated not for their systems reviews, but for their problems. Doing a review by systems doesn't help anybody, but doing a review by the patient's individual problems begins to help us understand what the patient needs and what we need to take care of. For instance, if someone's a drug addict, find out why. It's not that they're a drug addict, they don't have a job, they don't have things to do. Their endocarditis is not the problem, their drug addiction and their homelessness is. So figure out what their problems are and be broad in your application of it. Dig for the underlying illnesses, not just the cardiac or thoracic illness. In your initial evaluation and written documentation, those things are important. Spend your time there making it excellent. Don't spend your time on a daily progress note. Daily progress notes, for the sake of writing a note, help no one. Notes should be entered when something changes. Pacer wires are removed, a line is placed or removed, a tube is placed or removed. If someone develops an event such as AFib, sepsis, becomes hypotensive, that's the time to not write a note, not on day one when everything's fine. If some lab is off, make a note of it, but do not cut and paste things, and do not write long notes. You'll find we do things differently from most services. As an example, what works well for trauma doesn't work well for us. An overarching premise is embrace things that optimize the patient overall. We trade one system off for another. Sometimes a little hypertension is good for the kidneys. Sometimes a little water is good for the kidneys, but bad for the lungs. Sort it out and make trades. Most of all, have a great time. Get your work done. Don't waste time on long notes. Spend your time learning at the bedside from the patient and your attendings. Know how to present patients on rounds. It tells us whether you understand our discipline or not and the patient or not. Decide on a treatment plan. Be prepared to defend it. Don't get frustrated when it's overruled. Just see whether the decision we made was best for them or whether you were right. You know, Dr. Stewart's a good friend of mine and speaks really strongly of presuming virtuous intent in everyone we encounter. It's a great way to look at issues as they bombard us daily. As interns and for your entire career, you'll be bombarded. Take the shots, respond professionally, dodge or deflect stuff coming at you that you don't deserve, and send it to someone who's at the right level of experience or expertise to address the problems. Communication, communication, communication. You can rely on our outstandings, our residents, and our faculty. Use them, work with them, learn how to work as a team. If you have a problem that's really severe, go to the OR. Don't send somebody a text. Go to the OR, find the senior resident, find the attending, talk about it directly so that the communication will be perfect. Texting's not a good way to communicate. It's not a way to get a certified mail kind of answer. If you have a problem, it's best addressed in person or on the phone. When you're done with your shift, see what's left. Give it to someone else. Don't stay here thinking you're the only person taking care. So have fun, evaluate everything in your initial visit, organize it into problems by priority, write a clear, careful note, and then learn and think about the patient and become a better physician. Talk and examine your patients every day. Get to know them, their families. It's a great source of joy, of satisfaction. We appreciate the work you're about to perform and are here to help you learn, so thank you for being with us.